Hello and welcome to today's webinar with eLotus, your leading provider of acupuncture continuing education. This is our first weekend webinar of 2023 and we're so happy to have you guys here. My name is Donna Chow and I'll be hosting and moderating today's class. Question: how many of you use microcurrent in your practice? If so, type yes into the chat room. Perfect. As we're getting the response in, I just want to welcome you guys, continue welcoming you guys to today's webinar, which is Amplify Your Acupuncture Results with Frequency Specific Microcurrent, also known as FSM, Part 1, presented by Shannon Goosen, who is a practicing acupuncture physician since 2002, graduating with specialized training in classical acupuncture with yearly mentoring from J.R. Worsley. She now teaches for the military, provides private custom in services, and provides online training, which specialize in pain elimination. Class is from 9 to 6 p.m. Pacific time, and we will have 4 breaks with lunch from 1 to 2 p.m. Now for important details about the chat room, questions for our instructor, and your CU quiz. For the chat room, please do this now. Everyone, set your chat preference to everyone so that everyone and all attendees can see what you're writing, what you're typing, and be part of the conversation. For questions for our instructor today, please type them directly into the Q&A box. And finally, your quiz. It will be available the next working day. So that will be on Monday, and an email will be sent to you when it's ready. Okay, guys, it's that time you've all been waiting for. Let's begin and welcome Shannon Goosen. Thank you very much, everyone. And Shannon, thank you for generously sharing your knowledge and taking the time to teach us all today. For our attendees, if you enjoyed today's class, we ask that you could please share your thoughts on social media to help promote both our speaker and eLotus. We would really appreciate it. And as a reminder, the CU quiz will be available tomorrow, and I will email you when it's ready. Thank you again for joining us today, and we will see you guys at our next webinar tomorrow, January 22nd, for Part 2 of Amplify Your Acupuncture Results with Frequency Specific Microcurrent with Jimmy Yen, in which practitioners will learn how to incorporate FSM into a TCM practice, specific history intake methods that quickly reveal key underlying issues, and how to choose and apply dual-channel microcurrent protocols with TCM. This course covers fibromyalgia, conditions related to the peripheral nervous system, and emotional trauma, PTSD, and case studies for specific practices like fertility. That's it for today, you guys. Thank you so much, and we'll see you bright and early tomorrow morning. Bye.
Good morning. Thank you for attending. I'm really delighted that I can be here today for this presentation and webinar. So I want to thank Sam and Donna, and also let all of you know that today apparently is the first time we've had a live recorded webinar in the studio, and it is a lovely studio. I'm also joined today with Jimmy and his wife, and we are going to have a great time this afternoon. We're going to have some folks coming in order to do a demonstration for you. So if you've downloaded your slides for this presentation today, you can see we have a lot of material to cover. So I am going to just jump right in and get started, and I'll tell you a little bit more about myself along the way. So first, a disclaimer, very important. I want all of you to know we're going to be talking about equipment today. I'm going to be showing you a lot of different equipment. And I want you to know that I have no conflict of interest with this. I have absolutely no ownership in any companies that distribute devices, device manufacturers, and even anything associated with any kind of distribution companies whatsoever. I am in private practice. I consult. And then with frequency specific microcurrent and devices, I do actually do fee for service for consulting and doing customized protocols and putting together profiles for people on what they can use in their practice. My job has been to be a trainer and an instructor and make this really, really easy to be able to implement frequency specific microcurrent into your practice. And I'll be able to tell you more about how that has happened in different facilities, hospitals, and even in the military. So you can use any 2-channel programmable device to do an FSM application. I want to be really, really clear about this. I am going to be showing Mentech devices because if you show too many, it can get very, very confusing. And also, I have done all of my custom programming for Mentech devices, and it just will make it easier for us. But remember, if you already have any kind of 2-channel programmable microcurrent device, you are absolutely able to use that. And in a little while, I will show you all the different types of devices. So during this live webinar, we're going to be covering several different subject matters. I'm going to go into a little bit of the history and also go over some of the early research that was done and then also older research. In order to do frequency specific microcurrent, there is actually a language that we use. And it's important to go over that language so you understand what that channel 1 and channel 2 means. And I'm going to show you how easy it is to get the frequencies, and then it's even easier when these protocols are done for you and it becomes press and go. And there's a couple places that we really, really want to do this, and that has to do with acute pain or anybody that's had some kind of trauma. So you'll see how easy that can be to treat. And then we're going to go into chronic pain. It's important to know the difference between acute and chronic pain and understand why we treat them differently. So we'll cover that, and then we're going to go into persistent pain, and we'll be talking about the evaluation and also the protocols that we use and how you know what to do. And we're going to start with the central nervous system. We'll be talking about the spine, the peripheral nervous system, myofascial tissues, and then also I'm going to give you an introduction and show you the frequencies for organ tissues, and we're going to see how we can combine this really, really easily in an acupuncture practice. And then I'm going to also be talking about emotional issues and PTSD. So I'm going to go back over the housekeeping one more time. Donna, thank you so much for bringing this up. We are going to have 2 morning breaks. We will have a lunch break. It's going to be right around that 1 o'clock time, and then 2 afternoon breaks. I am going to stop after each section and find out if there are questions. And remember, Donna told you, please remember to put your questions in the Q&A dialog box. If for any reason there's a question that comes in, it's like, wait a minute, I really need clarification, Donna knows to interrupt and stop me, and we will answer those questions in real time. Otherwise, write them down, and at the end of each section, we will go ahead and answer questions. So now let's let the fun begin. So everything vibrates. So resonance is everywhere. So this universe is about resonance, and it's about vibration. And we have data and research that goes back. You've got the slide in front of you. It really, really shows that right down to subatomic particles, which organize into atoms, which then organize into molecules. And then we see that we can organize into cells and tissues, which become organs, and then biological systems, also called a human being. And then those human beings, we are an organism in that sense, can then go into social groups. And all of you probably are very, very aware that we are social. What happens between us and how we communicate with each other is very, very important to our well-being. Now, where's the other place that we know so much about communication and about the organization of these communities in these biological systems? Your microbiome. So we have a microbiome that is also an organized community within us that in many respects is running the show for what we're doing every day, our decisions, how we feel, our moods, whether we're impulsive, whether we can make really, really logical decisions. Our microbiome has a lot of say-so within their community about the community that it lives in, which is the human being, actually behaves. So just think through this now. Everything vibrates. There is resonance. What we are going to be doing with frequency specific microcurrent is I will be showing you frequencies that we can use to resonate with tissues in the body, with biological systems, with how we can influence what happens in our social communication with each other. So I invite you to sit back, relax, and just allow this information to come in. You don't have to memorize anything I tell you. You don't have to memorize frequencies. I'm going to introduce so much possibly new information about how we would think about our biological system, our physiology, and how the body works and things that can go wrong. And the reason I'm going to go back and do this kind of Western physical medicine with you is because there, in many ways, was no reason for us to actually learn a lot of this stuff and really embody it, because the teaching was, well, we can't do anything about that. Well, we can't do anything about that. All of us know from acupuncture and what we do with treating with herbs and what we do with lifestyle management and exercise and energetic techniques, we can dramatically change a lot of these things that we were told we couldn't help. And I'm going to show you a really, really easy way that you can go back and learn some of these kind of Western diagnoses and then be able to use frequency specific microcurrent in order in the background to treat all of these issues. So first and foremost, if you haven't heard of James Oshman, he's a PhD physicist, and James Oshman wrote a book on energy medicine years ago and the scientific basis for it. And more and more has come out over the years, as you know, and we are very, very clear. There is a scientific basis for all subtle energies that have to do with those electromagnetic fields. So just be thinking that every part of your body, including all the molecules, because I just showed you, they form a continuous interconnected semiconductor electric network. Every component and each component of the organism, the smallest part, is immersed in and generates a constant stream of vibratory information. There is just no way around this now. And you will find people that say, oh, that's hogwash, that's feral medicine, oh, that doesn't work. I guarantee you, they have not read the research. They are biased and only reading their own. And this is this amazing surgeon, Dr. Gumberto. If you have not seen Strolling Under the Skin, I highly, highly encourage you to go on YouTube and just put in either Dr. Gumberto or Strolling Under the Skin and watch these videos. What he did as a very curious surgeon was to go in the body while he was in a live human being doing surgery, and then he actually magnified what he was seeing with the tissue. He had the camera lit, he could see inside, it was living tissue, and then he created a video. He recorded what was actually happening with these tissues and the fascia. So this is fascia magnified that you see on the right. These are proteoglycan droplets, and this is basically these geometric shapes, and these forces are what hold our body together and keep our shape. This interconnected web allows for instantaneous speed of light communication in the body, which is why photomodulation and bioelectric information coming in that's resonance can get everywhere in the body right away and change it. So be thinking about this fascial web as also. So what he was able to state, and he's now written a book, Strolling Under the Skin, where he's got all of his beautiful photographs and the information on this. The matrix is believed to be the ground matrix for a high-speed signaling network using biophotons and electromagnetics. Okay, so this is what we're doing with our energy medicine, transmitted by a liquid crystalline structures in the collagen. And May Wen Ho wrote about this years ago also, and she wrote about the liquid crystalline structure of water. So please go ahead and look that up. And now, where's all this happening? Okay, what are we actually resonating with? Where is this vibration? Well, if you look on the far left and you are one of those people that took biology in the 70s, like when I did, what we had in our textbooks is that picture on the left. It was very, very mechanistic, lock and key. And we really, really thought that the nucleus inside the cell was the most important part of the cell. But it turns out that it's the membrane. And one of my colleagues, Carrie Zumwalt, she actually spells membrane B-R-A-I-N at the end of membrane, because it is the brains of the cell. Turns out the cell will continue to do all of its business if you suck the nucleus out of the cell until it needs to reproduce itself. Mitosis. And then it can't do it because you've taken out the nucleus that has the DNA critical information about that cell. But for as long as that cell lives, it'll continue to do all of its business. There's vibratory information and there is wisdom in each of these structures, and they know exactly what they're supposed to do. And now fast forward 50 years, and we know that the membrane is very, very complicated, and the structures that are going in and out, like integrins, are a form of fascia that go inside the cell, through the membrane, and then out of it. The integrins are actually checking on the outside of the cell to see what's going on out there and telling the inside of the cell what's happening. Meanwhile, it's also saying, hey, this is going on inside the cell. Let everybody know on the outside. So the brilliance and the communication on these cellular structures is incredibly complicated and super, super important. And then you can see the picture at the very bottom that is just showing you one form of protein communication and how complex it is. So we have a deeper understanding of everything that is happening inside the cells. Now, one of the things that we know after doing microcurrent for years and years and years, and now we've got thousands and thousands of articles that have come out on microcurrent, and I just did a search. So you can see on the right-hand side, if you just put in microcurrent, the thousands and millions of articles that come up about it, people are writing about this. But we know through these articles that there is a lot of clinical evidence and then some research evidence on what microcurrent actually does in the body and supporting physiology. We know that it helps with pain control, and we have used PEMF. I have a PEMF device right here going right now. And we have known from veterinarian medicine for decades and decades, written about in the 40s and 50s extensively with animals, okay, which animals, they just get better. You don't have to worry about any confounding factors with them. So we know that we can heal fractures. We do this with FSM as well. And then we can speed up healing, even though people that have wound clinics and diabetic clinics are still using more of a drug model or pharmaceuticals in many cases, but we can totally speed up healing and reverse it. And then we know from our injured athletes, because FSM is used significantly in the NFL. In fact, the last 3 teams that won the Super Bowl were actually using FSM in with the teams and in the locker rooms. And they actually have doctors that come in that are specifically doing this along with some of the other care. And then SOF, Special Op Forces. So I've been working with the military since 2018. I was brought in as a lead instructor to teach about frequency specific microcurrent in energy medicine in a demonstration study where the military said, hey, we got to do something about pain control, and we can no longer use narcotics, and we need to do other types of methods that are not dangerous, that are effective and fast. So I was involved with another doctor who was the lead there. I was the lead instructor for FSM. over a 4.5-month period. We basically went to the Air Force Base every 2 weeks, taught this, and then I was working in the medical clinic, family practice, residency, and in the hospital where we were actually treating their most complicated, no one can help these people, patients who were, they call them frequent flyers, and they also use up the most amount of resources. Well, we were actually able to get positive results, get people out of pain in every single case. And it happened within 2 to 3 appointments, sometimes on the very first appointment, including someone that had phantom pain and severe, severe chronic pain everywhere else. One visit, phantom pain was gone, low back pain was gone. She was up, moving very, very quickly and back to her daily life. So once they saw this happen, it ended up that I also was invited to work with some of the special op forces, and we were able to reverse some very, very serious chronic pain problems and deal with serious injuries that these people have had. They know that this is working. So this has been ongoing research with the military. They started formal research in 2019. The first paper is going to be released this year, the retrospective from the last 3 years. So the military is definitely onto this. They're using this at Nellis Air Force Base, Scott Air Force Base, Eglin Air Force Base, Walter Reed, Andrews, and several others. Some of you may know Richard Nimzow, who is just so dear, and he has been using frequency specific microcurrent, and I've been teaching for him for the last 3 years, working with his group, and the military has completely embraced this. The NFL has completely embraced it. It's time for the rest of us to completely embrace this and integrate it into all the wonderful things you're already doing. So the other thing that happened after 2019, when I was working with the special ops, I was also invited to work with the Wounded Warriors for the Warrior Games for the Air Force. And then I was at the big competition to figure out who goes to Invictus, which are the World Games. And they saw frequency specific microcurrent. I was working with a brilliant psychiatrist who also does acupuncture. He's the one that developed the Myers cocktail, and it was all part of the battlefield acupuncture and acupuncture that they teach in the military. And I ended up being selected for the World Games to be part of the team. And that was supposed to be in The Hague in 2020, but of course, obviously that got canceled. But people at the Pentagon and people that came in to see what happened, it was like, oh my gosh, we really, really need to have this. Fortunately, the medical director for Warrior Games is actually using FSM. So what is it? So I've been talking about microcurrent this whole time. Some of you may be going, oh my gosh, I have no idea what this is. Microcurrent is current that's delivered in a millionth of an ampere. So it is really, really a small amount of pulsating energy that goes through. It's really much closer to what is actually happening in the body. And the body has to adhere to the natural law of electricity. So that means if you've got an area that's been injured or damaged, or there's scar tissue or congested or something happened, you know about the body's piezoelectric energy, piezoelectric, people pronounce it both ways. Well, the electricity will go around the tissue and not through it. And the place that needs it is through it. When you use microcurrent or frequency specific microcurrent and you run it through an injured area, you can actually get the current that the body needs in the tissue. So this is where microcurrent is so powerful adjunctively. The body knows how to heal itself. And we can actually get the energy and the information. And of course, we do this with acupuncture also, but we can put it directly in the form of electricity. So these currents that are coming through, they're compatible. I will tell you, when we're doing TENS for pain control, it's not compatible. It is 10 to the -4. It's 10,000 amperes, and it stimulates the nerve baton, and that causes the muscle to contract, which means you're using up energy. We're trying to get energy back in. You're taking it away when we're using TENS for pain control. It will help with pain control, but it actually interferes with energy production. Whereas when you use microcurrent, you're actually increasing ATP, collagen production, protein synthesis. You can get the good stuff in and the bad stuff out whenever we're doing this. And it's this small therapeutic dose. We don't have to worry about overdosing. We don't have to worry about needles turning, so to speak, and a treatment turning. It's there. It gives you what it needs. And as long as you've got water on board, whenever it doesn't need any more, it just doesn't do anything else. So it's really, really easy and convenient to use. So we don't have to worry about overstimulation from other modalities, especially when we're using these higher currents that are making the muscles jump and putting sometimes some uncomfortable electrical information. So let's go into the published papers on frequency specific microcurrent. I just want to remind you, this goes way, way back when we saw early studies on microcurrent. So this is basically 40 years ago, right? And it was from that, and they've been able to reproduce this. All of you know about the glycolysis, you know about the Krebs cycle, electron transport system, and how we are actually getting information into the cell, into the mitochondria, and then the mitochondria are producing energy for us in the form of adenosine triphosphate. Well, when they did this research, they showed that these small microamps that come in with microcurrent can actually increase ATP up to 500%. Now, it's not necessarily going to be 500% that some people say, but up to that amount, which is exactly what people need when they're trying to heal from something or they have any kind of energy deficit. We have the ability to help out the mitochondria in the cells and improve people's energy. So why would you not do this? And then any of you that have been doing any kind of anti-aging, even on top of just wound healing, what is the molecule of life? It's protein. So what if we have this way to very, very quickly increase protein synthesis and collagen production? Wow. So this is where when we put microcurrent into the body, it is healing and helpful. So Carolyn McMakin, way back in the 1990s, she got it's a big blue box. You'll see a picture of it in a little bit. It was the old analog machine. They don't make them anymore. Those of us I still have 3 of those analog boxes. We'll probably never part with them. But they were really, really bulky and you had to put in all the frequencies one at a time. But we already had the research about what happens with microcurrent. So Dr. McMakin was using microcurrent to basically bring in extra income to her new practice, which was fibromyalgia and myofascial pain. And she was doing microcurrent in order to do anti-aging. So she was doing aesthetics because microcurrent works fantastically well to help the skin, help the body. When you use FSM, it's inside and outside that we're able to help people. So what happened is she's doing the aesthetics and anti-aging and oh my gosh, all of a sudden people are getting out of pain. And then she stumbled across some of these old frequencies through George Douglas. And then she found out that she could run a particular frequency combination on channel A and channel B, or channel 1 and channel 2, which was 40 inflammation on channel 1, and on channel 2 she ran 10, which is the frequency that is recorded for the spinal cord. And all of a sudden these people with terrible, terrible pain, it was just going away just like that. So she was actually invited to NIH, which was great. And this was in 2000. And while she was doing her selected case study saying, hey, this is what's happening with fibromyalgia. And remember back in 2000, it was if you were doing nutritional stuff, it was not enough nutrition in one way and you needed to heal a leaky gut. If you were medical, it was a benzodiazepine deficiency, which was ridiculous. And then everybody was told, yeah, you can't cure it. Well, what do you do when you're told that by all the experts and all of a sudden it's the easiest thing you do is get people out of pain with fibromyalgia? That's exactly what happened in my clinic in the early years when I was doing this. As a myofascial pain expert, all of a sudden I was getting people out of 7, 8, 9, 10 out of 10 pain from fibromyalgia. And it was only taking me one treatment to bring their pain down. And then it was just the cleanup on the rest of it. So what do you do when you are, I'm going to use the word cure, right? Because that's what it looked like to the patients. a problem that nobody has been able to figure out and hasn't been able to help. Well, she asked in the audience, and fortunately, Terry Phillips, who was one of the most prolific writers on the immune system, brilliant researcher. He just happened to be in the audience, and he said, if you send me blood patches, I will tell you exactly what is happening inside the blood of these people. So Carolyn McMakin sent in all of that information. She had her case studies, and the paper finally got published. It took a long time to get it published because nobody could believe the outcomes, even though it was Terry Phillips that had evaluated the blood. And we had all of the statistics on it. So everyone except for the control, okay, the control didn't change. It didn't help that person. They just had a regional myofascial pain problem, but everybody else had a cervical injury and had full body pain. We're going to go over on why that happens. So you can see on the right with the numbers, the only thing that you have to look at is the really bad stuff was at a very high number in the beginning. And then at the end of the 90-minute treatment, it was much closer to normal. This happened with every single patient, and it happened very quickly. Now, the curious thing that happened was patients always report when they're getting FSM, it's like, wow, I feel like I'm drugged, or I've had a couple glasses of wine, or I'm really sleepy and kind of out of it. Is this normal? Well, it turns out that beta endorphin goes up early on in the treatment when we're treating some of the brain protocols that reset. It causes the beta endorphin. So that is the feel-good feeling that patients will sometimes get when they're running microcurrent. So this was published long ago. And we've known about this. The military, fortunately, the folks that I'm working with, they are going to reset this up and set it up. But those of you that know about substance P, you can see how dramatic that was. And it really brought down those inflammatory cytokines. If you know about inflammation, you know that interleukin 6 is the one that really wreaks havoc. I refer to it as need a cleanup on IL-6. And so that dramatically came down. So, oh my gosh, we can change what is happening with the inflammation in people that have had these injuries. So shortly after that, Carolyn McMakin was going to Australia at the time, and she was introduced to Vivian Reeve, who is the researcher in Australia at the time, who basically anything that had to do with an anti-inflammatory treatment or drug had to go through her clinic. And so Vivian agreed to do research on frequency specific microcurrent. And the question was, does the frequency matter? Does it have to be specific? And it turns out it does have to be specific in order for us to reduce inflammation. So what Vivian Reeve found out in the animal model, they had the albino mice. These were knockouts. They were all cloned. And so what they were able to do is put arachidonic acid on the ear of these little critters, poor guys. The good news is they got treated. And then they used calipers in order to see how much swelling there was. And so what happened is when they ran the frequency for inflammation, 40 in the immune system, which is 116. So on the left-hand side, you'll see there's for 4 minutes, 40/116. And then the other frequency was 40 inflammation in the skin, 355. So they ran those frequencies for 4 minutes, and they were able to, and everybody was in there, get 70% reduction in inflammation, which Dr. Reeve had never ever seen, not even with injectable Toradol. So she did throw everybody out of the room, and then they blinded everybody except the animals, didn't have to blind them, and it was still in the high 60s. So when they went through all of this research and they were treating them, they basically did a second part of the experiment because they wanted to see if it would be lasting. Because one of the things that had happened is everybody that had been getting microcurrent said, gosh, I feel better. I don't get sick anymore. I have more energy. And so was there something that was happening in the immune system that was lasting? And so they have a understood model where you can give someone a laboratory sunburn, okay? And whenever you get a sunburn, it actually suppresses the immune system. So what they did is they gave them a laboratory sunburn, and then they treated them in different groups. They got no treatment. They got treatment with microcurrent at T0 hours and then also T2 hours. So it's like, what happened? Does it matter? Because they had already seen if you treat right away, inflammation goes down. Well, it turns out that we were able to see inflammation come down 4 minutes every single time. And after 4 minutes, nothing happened. 2 minutes, you got a 50% reduction. And then when they used a dummy frequency 40 and 103, nothing had happened. So now they've got these animals, they gave them a sunburn, and now they're going to treat them a couple weeks later. And then what they found out is that the mice that were treated at T0 hours, their inflammation went down. But if they were treated 2 hours later, what happened was they had a normal immune function. It was as if they had never gotten a sunburn. So it was pretty dramatic. So when she went through all of this research, it turns out that much greater than 60% reduction in inflammation in this animal model and in ear swelling, once you ran either 40 and 355 or 40 and 116 inflammation in the immune system or the skin. And it was repeatable. Every single time they did it with the experiment, the same thing happened every single time. And the frequency had to be specific. The dummy frequencies didn't work. It had to do with those inflammation frequencies in the immune system or on the skin. And then the other thing that happened was when you gave the animals that sunburn, which would have suppressed their immune system, which we all know about that because we're at risk for skin cancer, right? If we've gotten too much sun. Well, guess what? The animals that had gotten the microcurrent at T0 and T2 hours had a better response, but the animals that got microcurrent 2 hours after the exposure had a near normal immune response after they irritated the hind leg with something called oxazolone. So this is where they do a chemical irritant to the body, which should mount an immune response. And the animals that had not been treated did not mount a normal immune response, and the ones that did. So this was really, really helpful to all of us. It's like, something is probably happening. Now, granted, this is an animal study. We use animals all the time. We see this clinically with people with how they feel. And no more important was with delayed onset muscle soreness. Even to today, there's basically, people are saying there's not much that you can do about delayed onset muscle soreness. Denise Curtis is a physiotherapist in Ireland. She did a very, very well controlled study where she exercised some athletes until they would get delayed onset muscle soreness, and she treated one side and not the other. Now, the beauty of microcurrent, which is why this worked in the military so well, is you can't feel it. It's subsensory because it's the same current area degree of current that's running through you right now. You don't feel it. Just like if there's nothing wrong with your body, you don't feel the current in your body. It's subsensory. So you don't know that it's running. You feel the effect of it, but you don't feel the current. So it's really easy to start blinding people. So in this picture right here, those are those big giant blue boxes. So you can see you would not be able to travel around with these. Now we can put them in our pocket, our purse, and carry them anywhere we go. So she set this up, and then here's her results. So on the first 24 hours, okay, you would normally expect to really be having some pain. And the leg that was treated, not so much. 48 hours is when the pain is always the worst, when you're going to get delayed onset muscle soreness. And it was even less than it was on the first day. And then on the third day, everybody was essentially at a 1 or no pain whatsoever, whereas the non-treated still had pain. So this was significant. The p-value was 0.0005 at every single measure. So this was published in a journal in 2010, Journal of Bodywork and Movement Therapy. And there are still people that will tell you, nope, can't treat delayed onset muscle soreness. We reproduced this research. I did this at Warrior Games. I did this at the Iron Horse race in Colorado, where they bike up the mountain and then they have time trials in the city of Durango. all of the people that were treated right after going up the mountain, which is the hard part, none of them had delayed onset muscle soreness, and they all won the time trials the next day. So we use this in all of our athletes. We use it in special forces and people that are running marathons or doing extreme events of any kind. We've been able to get these same results every single time. So this is what we know in clinical practice and how we can figure out what's happening with the microcurrent. Whenever you are using FSM, the tissue changes can happen very, very rapidly. And what we feel is this softening in this tissue. We call it smush. Most people that have good manual therapy skills or good palpation can feel this very, very quickly. It's typically allopathic physicians or people who are not used to touching people that it takes more time for them to learn this. We're actually working on an objective way to know exactly when these frequencies are responding so that someone doesn't have to do the smush test and it takes the subjective nature out of it. But once you feel it, you know you have felt it and you know that things have changed. Sometimes the patient is just going to tell you. And that's because they're going to say, wow, I'm starting to get really, really warm where this is and I'm so relaxed. These are indicators that that resonance is in progress. And the thing about microcurrent, like I said, you don't have to worry about overdoses. When it's done, it's done. Our challenge in human beings is we don't know when they're done. So some of the protocols actually last a little longer than maybe they need to, but it's just to make sure we get the full effect. We're pretty certain how long we need to run some of these protocols, especially anything having to do with trauma. So we know that we get lasting effects because people tell us, I am so much healthier, I look younger, I feel better, I have more energy, and I don't get sick. That's exactly what happened in 2019, 20, and 21 when I went back to the Air Force bases where they were using it. They're like, gosh, just don't get sick anymore. And if something happens, I mean, I just bounce back so much more quickly. So this is where these people are telling us less pain, more well-being. Now, the good news is there have been some publications, and Carolyn McMakin published her book, Frequency Specific Microcurrent in Pain Management, over a decade ago. And then we have had case conferences. Jimmy and I were just at the annual Microcurrent Case Conference in October. It'll be in October of 2023. You're all invited to come to Chandler for that. And so for 3 years after I presented in the 7th annual Microcurrent Conference in 2013, the organizer at the time actually recorded everything that was happening at the case conference, and then he got all of the audio recorded, transcribed, and he created books of the proceedings. So these books can still be purchased through Ning Wu at Inspiristar, and it's everybody's cases. So we have thousands of these cases that have happened. We have thousands of practitioners that have given us their feedback. We know what has happened with the military and the NFL and professional athletes and people that have healed from trauma. So we have several cases that are published. So any questions that have come in? I'm looking at Donna right now to see if she has anything for me.
Someone asked, are these two Lhasa eSTEM devices microcurrent? Oh, it's a link. You may have to look at that later.
Okay.
Is this safe for pacemakers?
So we're going to get into that, and technically no, unless you can put a magnet over the pacemaker to keep it paced. Most of them are demand type pacemakers, and we have practitioners that just don't run it near the heart or through that area.
By what unit frequencies are measured?
Amperage.
What is the source for those books?
We will put it up for you later. So it's Ning Wu through Inspiristar has access to those books. And then also Men Technology has access to those books. And then Frequency Specific Microcurrent in Pain Management, or the Resonance Effect, both written by Carol McMakin. You can get those at Amazon. And the Resonance Effect has all of these great stories from the early years and what we had done with professional athletes. Carolyn McMakin was brought in to treat Terrell Owens in 2005, well, actually 4 or 5 before the Super Bowl. She was in Jacksonville with me for that, and they told him he would be out for 4 months. He was radiographically healed for his broken ankle in 4 weeks, and the ligaments were healed, and he was ready to play 6 weeks after his injury, and they basically told him he would be out. So then there's all kinds of other professional athletes and stories.
Can you explain the difference between microcurrent and millicurrent, as some devices have both?
Right. So microcurrent is 1/1,000,000th of an ampere, and millicurrent is 10,000ths of an ampere. So you can actually fill the millicurrent, and as an acupuncturist, we use some of this. We can turn it way, way down to stimulate acupuncture points. We're actually driving information through the nervous system in different ways. And when used properly, and not for pain management and getting someone to, especially when someone is severely injured and you're trying to keep the pain down because you're interfering with the healing, this is where we want to be using both. And you can. This is why this is such a great match for acupuncture physicians.
Do you need to place the machine on the affected area?
We are going to demonstrate it when I actually have slides of that. So we're either running it in the way that the central nervous system runs in the body, which brain spinal cord. We're following nerve roots. So from the spine to the end of the nerve root. If we're treating organs, it's through the organs. If we're treating tissue or a structure, we're running it through the structure, and we will demonstrate that. And I also have pictures showing you. Great questions.
Do you need to place the, I already am. Sorry.
Okay. Okay, we ready to go through the language? Okay.
Is there for different tissues, example, bone, ligament?
That is perfect that you are asking that. The question was, are there different frequencies for different tissues? Yes, and we're about to go through what your questions were and about those frequencies, and I'm going to show some of them to you.
So chronic pain could be cured with one treatment with correct frequency.
Correct.
Then why do people come back? Is it re-injury, repetitive injury? And can microcurrents treat neuropathy?
Microcurrent can treat. Okay, so, and then were they able to hear you, Donna? Okay, so the question was about treating a neuropathy and why do people come back in with repetitive injuries. So we'll be talking more about that tomorrow also in the case studies, but we can actually correct what's going on with the nervous system with frequency specific microcurrent. And yes, there are very specific protocols for peripheral neuropathy coming from any reason, which I'll be covering later today. When someone has repetitive injuries or they keep getting injured, they are telling you that something is wrong with the way that they are using their body. That is the area for which I am an expert. So my claim to fame, if you wanted to put it that way, within my peer group is that I'm an expert in myofascial pain and dysfunction. And along with the frequency specific microcurrent, I've delivered and created a very, very fast way to identify these structural issues or behavioral issues or things that are happening with the body where people can't properly stabilize to do the motions. So in the military, we were able to demonstrate that people that had things get wonky, that were really, really well conditioned, or with professional athletes and dancers, we can also correct that very, very quickly with just doing something called getting their stabilizers on, which we'll be talking more about. So there is absolutely a way, once you get them out of pain, then you go back and figure out what is it that you're doing when you leave the clinic that causes you to continue to have pain. I hope that answered the question.
Okay, last question before we move on. Is FSM the same as an e-stem device?
FSM is an e-stem device, and we're about to cover that. So the question was, is FSM the same as e-stem? It's categorized under TENS. All of the devices are. That's the predicate, and we're about to cover that. Great. Thank you, Donna. So here's your contraindications. So we're starting out with that. You need to know that absolutely, absolutely, absolutely never ever in pregnancy, because we're basically modulating inflammatory cytokines and other things, and we don't know what that would do to a developing nervous system, so we just don't do it. And then you have to be able to turn off electrically powered devices. So these are all of your spinal cord stimulators. These are your artificial pancreases, okay, your baclofen pumps. Anything that has an electrically powered device, you have to be able to turn it off to run microcurrent. I was in a spine clinic for over 15 years, a surgical practice. My long suit is in spine and neurology with the myofascial pain. And we had the ability to actually have the reps come in while we were running microcurrent to demonstrate, yes, it does interfere with a baclofen pump. It does interfere with a spinal cord stimulator. It does interfere with hospital monitors if someone's on a monitored bed. So you have to be able to turn it off or you can't run the microcurrent. And then organ transplants, and this is just what is in the absolute no-nos for all TENS devices. And that, I'm going to say, is important unless you really, really know what you're doing, because when you've had an organ transplant, the first thing they do is put you on medication to suppress your immune system so you don't reject the organ. What if we are making the immune system more vibrant and strong? We could actually interfere and someone could reject an organ. So super, super careful. And then you have to think a little bit differently and upstream, which is what I'm going to teach you. And then we don't treat cancer directly, and we don't run microcurrent through cancerous lesions. There's a lot of reasons for that. Some of them, you just don't want to give them the extra energy. And then also it's a very, very murky waters to be walking in, and you're not supposed to do it. So you're not protected if something happens. And then open wounds. Now we run across a wound area, but not directly on it, because it will just hurt. Any current, even microcurrent, which is subsensory, becomes sensory when you put it on, I'm going to call it raw tissue or open tissue where we don't have the skin barrier. So there's your contraindications. But the good news is this is most of who your people are that are coming in, right? You've got orthopedic cases. You've got people that have had surgeries, knee replacements, hip replacements. They've got pins. They've got stents because they had some kind of cardiovascular issue. So it's completely safe to run microcurrent on those people because it's physiologic. So not a problem. Just remember, anybody that's got any kind of electrical device running in their body, you just have to turn it off before you run the microcurrent. Now, there's one other special precaution with microcurrent, and that has to do with infections and any kind of illness. And that's because I already showed you that microcurrent can reduce inflammation, and the body uses inflammation in order to fight infection, especially bacterial. So with your patients, two really, really important questions. Do you have an active infection? No. Are you on antibiotics? Yeah. I thought you just said you don't have an infection. Well, I don't, because I'm on antibiotics and I feel much better. You and I both know that they feel much better because we have killed some of the pathogens with antibiotics. If someone has gone to an allopath and that is what they have done, okay, you would want to do the same thing with herbs if you're using an antibacterial or viral and you know someone is sick, but they're on that medication. What's left behind are the strongest and the most virulent of whatever the infection is. So if we suppress the inflammation that is also still there to fight it, you can actually blow that infection up. So just be very, very mindful of that. And then the good news is that we have protocols that are just press and go, that are specifically for infections, that are completely safe to run while people have infections and intended for it. So like shingles, for example, there's a protocol for that. There's bronchitis. We developed a whole series of protocols for the virus that came out in 2020. That was actually 2019. So we have been very, very successful with supporting the body for this. And then also there's all kinds of protocols where 40 inflammation is not in the protocol, and that is safe to run. So just remember that. Now let's go into that language. You were asking about the frequencies, and this is just a super, super busy slide about everything we do to communicate what we're doing with frequency specific microcurrent. And remember, we're delivering micro amperage. So the U means micro, and we're typically using 100 to 200 microamps when we treat most people. Now, when I treat an NFL person or someone who's a linebacker or offensive line, and they've got ham hocks for quads and thighs, I may increase it to 300 or 400. And then also we use FSM for treating animals and large animals. Horses actually love microcurrent. You're going to increase the microamperage. But if you're treating someone who's sick or small children, you're going to bring it down anywhere to 20, 30, 40 on the microamperage. So that is adjustable on these devices, which you'll see. And then the current is either alternating or polarized positive. With this particular device, we don't use negative, although there's a couple times that it has worked. But the convention right now is you're either going to choose alternating, which is plus minus, or you just write ALT, alt, or polarized positive, which is plus, and then polarized. So alternating is the current going positive, negative, positive, back and forth, whereas polarized positive, you're just pushing it through on the positive side of the current and pulling it through the body. And then we've got very special waveforms that we use. With the old analog box, it was ramped square wave, and you could only use a dial, and you could go from the most gentlest to a medium to a very, very sharp. So the automated units, you can actually program in your waveform, or they're already pre-programmed for you when you select them, which means everything that is press and go already has the correct waveform with it. We are always using a gentle wave slope whenever there's a new injury. And then if you've got like really, really scarred down old sick tissue, we're going to use sharp. But the trauma protocols or anything acute, it's always going to be those gentle frequencies. So when we're running these frequencies that we're talking about, we're thinking about something that we want to neutralize for one of it. So this is going to be on channel 1, which you'll see. And so there's specific frequencies that neutralize. So if you see the word inflammation next to a frequency, we're neutralizing inflammation. So there's much, much more to it with resonance, but when you see this picture of this glass, the glass is not shattering. For those of you who are old enough to remember Julie Andrews, where she's in the back of the cabaret and she's singing this really, really strong pitch and note, and the crystal glass shatters. Well, it didn't shatter. It fell apart because she sang the exact note that resonated with the covalent bond that holds lead crystal together. So this is time lapse. It's just falling apart. The resonance that holds it together was interfered with a frequency. So think about neutralizing conditions, but we can also support conditions. So one of the most powerful ways we support is 81 secretions. This works incredibly well with the frequency for the fascia, which is 142. This was one of the cases that I presented at the 7th annual case conference when they started publishing the books and the transcripts. I'm going to share with you one other case also on a little girl and a spinal cord problem. This is a person that has something called the diastasis recti, which means that the linea alba, or the tissue that holds your two recti muscles together, has lost its integrity, and then you end up with belly fat, and actually the viscera can start coming out. This is really, really common in women after birth. It usually knits back together, but sometimes after multiple births, bad sit-up style, all kinds of other things that can go wrong, you have that diastasis recti. This woman got 14 hours of microcurrent in one of my colleagues' clinics because she wanted to see if she could reproduce my results. I had been showing my colleagues for quite some time. It's like, oh, I can fix that diastasis. I can fix that right now. And I was running the frequencies for secretions in the fascia. Remember, we talked about Gumberto at the beginning, and it seems to cause it to secrete ground substance, and the tissue knits back together. Now, people that have never seen this would say that's impossible, except this is what happened after 14 hours of microcurrent and no exercise. The diastasis knitted back together and this person got their tone back. This is really, really important from a stabilization standpoint because this can actually cause backache. So that was published in that 7th annual microcurrent conference. And that year I actually won first place for my cases. So when you have something on channel 1 and channel 2, which I keep talking about over and over, I said 4116, 4355, you're hearing me throw these numbers around. Channel 1 is the condition and channel 2 is the target tissue. I refer to this as the issue in the tissue. Channel 1 is the issue, channel 2 is the tissue. And there are thousands of target tissues that we can use. And just in the physical medicine side of it, just like someone asked, you've got all of the neural tissue, you've got all of the brain parts, you've got all of the bone parts, you've got the fascia, you've got the cartilage, you've got the periosteum, you've got the tendons, you've got the muscles, you've got the fascia, you've got vessels, you have all of it. And so we just combined what's the issue. Okay, so this is where it's like you've got to put your thinking cap on and think upstream or deeper rather than just symptomatic. What is the issue causing the symptom? So we're going to what is the core issue in the tissue? And then you just match those frequencies. And the strategy that we use, if you listen, the patient will tell you what's wrong. So that's the beauty of that history taking. The patient will tell you exactly what's wrong and what they need. And so this is where what they're asking is, will you please remove the pathology that I have, that's channel 1, in this tissue that's bothering me so much, that's channel 2. So these are the things that are causing and perpetuating whatever pain problem they have. So this is where I want to say, and just really, really take this in right now. When you use FSM, you're going to treat upstream. You're going to say what is really the issue in the tissue that is perpetuating and causing this downstream problem. So this is where with microcurrent, we can now do that where someone said, yeah, there's no way you can treat that. But now you can with FSM, and then you're going to be able to do your acupuncture treatment. You can do herbs, you can do tune, you can do any other treatment modalities along with this. It fits right into your doctor's bag, your practitioner bag for whatever your favorite modalities are, and you can run it in the back. So someone comes in, Shannon, my muscles are inflamed. I have inflammation in my muscles. Well, what's the frequency for inflammation? It's 40. And then there's a frequency for muscles. It's 62. It's also artery, which we'll talk about, but we use it for muscle. So if I was telling someone what I would do, I would say 40 on channel 1, and then you have a slash. And then the second number after the slash is the target tissue, the issue in the tissue. So any practitioner that does FSM, if you said, oh, this person came in, they were 40 and 62, it's like, oh, they had inflammation in the muscle. Someone would just know that. It is a language. We are trading words for numbers. Now, if they've had trauma to the muscle, the frequency for tissue trauma is 294, and then muscle is 62. So it would be 294 slash, okay? So once you're on the right side of the slash, that's the target tissue, 294 and 62. How many of you actually have people that just have like one issue in one tissue? It just doesn't happen. Our patients are complex, and we end up with these complex sentences. And then this is where you have a string of issues in a particular tissue. So, oh my gosh, I have inflammation. It led to calcium deposits, which, oh, by the way, calcium shows up at the scene of inflammation because it's our natural anti-inflammatory. And then once you have had calcium in an area, which is like little shards of glass, you usually end up with scarring in the tissue. So can you see if we can really think it through now? It's like, oh, if you have inflammation and it's been there for a while, you're going to have calcium deposits, and then you're going to have scarring. So that's 40, inflammation, 91, calcium deposits, scarring, 13 in what? the slash 62, the muscle. But do we really have people like that? No. It's multiple issues in multiple tissues. So then you can see where these tissues, protocols can get kind of long, which is why when we had the old blue box, you really, really had to love it and want to do this because we had to change all the frequencies. Now it's press and go. You start the protocol for that problem and all of these frequencies will run for you in the background. But on some of the devices, you can still modulate things if you want. So what typically happens, which you're going to see, if you have a muscle issue, there's nerves that communicate from that muscle to the spinal cord and to the brain. And the spinal cord actually blows up information. It amplifies it. Okay, so then the spinal cord gets irritated. So typically with a muscle or a myofascial problem, you're going to have inflammation in the spinal cord, in the peripheral nerves. Spinal cord is 10, peripheral nerves are 396, and then the muscle. So we're going to run inflammation with all of those tissues, and then you're going to end up with calcium deposits and scarring in all of those tissues. Now, here's the finesse of it. You could actually treat all of those target tissues with 40 first, or you could treat 40, then 91 calcium deposits, 13 scarring with just the spinal cord, and then just the nerve, and then just the muscle. There's certain ways that we have seen in an order that this seems to work better, but you get to choose which way you want to do it. So this is where some of the finesse comes in. So I hope that you were able to understand that language. I'm just going to check with Donna right now to see if everybody is clear on the frequencies. So Donna's looking right now. Are we good, Donna? Okay, great. So we'll hold it to the next part. So someone asked about the frequencies. Okay, I've listed a bunch of them for you. I'm going to tell you right now, in 2022, 2023, you do not have to have any of these memorized. The beauty of what we've been able to create is protocols that we know work consistently every time. We have different ways that these are set up depending on whether you can see a patient for a very long time or you have shorter practices. It's all done for you. You can see the frequency so you know what's happening, but it's all press and go. So this is an example of where I've got booklets put together, and this actually shows you how to actually do microcurrent, and then the protocols are set up. So all of this is done for you, and then when the devices come to you, they are just preloaded for you with what you wanted, or you can buy software and you can do it yourself. So there is a big difference between what we do with acute injuries and chronic. Remember, I told you about that in the very beginning, and we want to make sure we know. So what's the first thing we want to do if someone got hurt, right? There it is. 18 is the frequency for stop bleeding. The first thing we want to do is stop the oozing and stop the bleeding. And then there's going to be trauma to the nerve. So, did anybody say, oh, by the way, we can deal with trauma very easily? There's so much we can do with acupuncture, but now you've got frequencies that will resonate with these tissues and do all of it in the background for you while you're treating someone. So nerve trauma, tissue trauma, we already talked about that. That's 294. They're different frequencies. And then if a tissue is not doing its job anymore because it got hurt, we can reboot it. We can remove the allergy reaction from the tissue. Janet Travell with myofascial pain and dysfunction from decades ago was talking about there's always a histamine reaction, 9 allergy reaction in the myofascial tissue when something has happened. The tissues have been torn and broken, 124. We can remove the fact of torn and broken. And then what's the first thing that's going to show up for healing? Inflammation. And then we want to take care of the pain or nerve pressure that people have, 20, irritation to the area, 30, congestion, 50. So you can see where you just put in all of these frequencies, which remember are done for you for these protocols with whichever tissue had the problem. Now, persistent pain or chronic pain, these frequencies are different. Notice that you've got calcium deposits, you've got scarring, sclerosis, fibrosis. you would never, ever, ever run these frequencies on something that is trying to heal, because that is the stuff that knits it back together. The great news is if we treat acute and trauma immediately, we don't end up with all of that scarring in the same way, because we change the way the tissue can heal itself. The body needs no help, only no interference. The body needs no help, only no interference. Using FSM removes the interference from the body so it can do what it's phylogenetically programmed to do. We also do that with acupuncture. So again, on the frequencies, look at all these target tissues. This is just a handful of them. So all the way from the brain to the spinal cord to the dura, arachnoid, pia, sympathetic nervous system, the nerves, the sacral plexus, the bones, the periosteum, cartilage, joints, you name it. We have a frequency for almost everything, not everything, but almost everything, and the different parts of it. So this is where there's a couple of people that I talked to, and then I had this conversation with Rena. Even if you don't do frequency specific microcurrent, by the end of today, you will know so much more about physical medicine and what the mechanisms really are that are happening with your patients. And you can use the modalities you have. Now, obviously, I encourage you to add frequency specific microcurrent because it's so easy to use and you can run it in the background. If you don't, though, you're going to know so much more about physical medicine. So let's talk about what these devices are and what they look like. Now, remember, I told you I was going to be showing you the men devices. I've got a couple of other devices in the pictures and one other one here for you to see. Here's the example. So this is in a clinic, and people that have very, very busy practices, they will actually do multiple modalities, as long as you have the polarity right for everything that you're doing, in one treatment and add it in. So in this picture, and I don't know that I'm going to use this right here. In this picture, some of you may know who Darren Starwin is, and he has Microlight. I also work with Darren Starwin, and he's been doing microcurrent and has had microcurrent devices out for a very long time. He uses light therapy going into the acupuncture points. He uses Russian, interferential, and microcurrent. So Darren is also using a lot of these press and go protocols that I have as well, where people can get them put into their device. It just makes it so much easier. So this is Darren Starwin's Microlight. It plugs into the wall and it's big. You can't take it with you. This is the old blue box right here that I told you about. Gigantic, analog, could not take it with you. And then we had custom cares come out and home cares. These were smaller. They're on a DINS plug, and there's not a lot of flexibility with what we can do, but they were pre-programmed and you could program them. So that was the beginning of what we could do with having a lot of flexibility with our devices. And then we have the Mend technology right here. And so this Mend Professional holds up to 999 protocols. There's no other device that does that, and nobody has actually even filled one of their devices yet. So these you can modulate. This device right here from Mend Technology, that tiny little box, did everything that that big giant blue box did, except that you could also put in protocols where all the frequencies were strung together and you could program it, and then you could change it in real time if you want. And then right here is a Y-prong electrode attached to a Vazia device. Now, a Vazia is a single frequency microcurrent device, although the frequencies on some of their algorithms change. It's a sinusoidal wave. It works fantastically well on scar tissue. So this is where I'm telling you, in many ways, I'm agnostic and I use all of it. And then there's a PEMF device right here, which basically is touted to have quantum embedded information, which I believe it probably does. That's the device that I am running right here up at the front. This has just got a blue cover on it. It's got electrodes on the back. It also delivers a single channel sinusoidal wave where we can resonate with the tissues. So this is an example of people using all types of these different devices. And this is exactly what the military ended up adopting. So when we went in, we brought all of the equipment, and they have MEN technology, they have the Avasia, they're using lasers, then they're using several other devices, including Calmar. Some of those devices are up anywhere from $10,000 to $100,000, whereas these other portable devices, you can get one for as little as $1,400. So the Avasia devices, you could get one for a simple one with 2 algorithms on it for under $300. And they also do anti-aging. So that's just to show you all of these choices on the devices. If you're going to do frequency specific microcurrent, though, you have to have one of the devices. You have to be able to program 2 channels. It has to have a channel 1 and a channel 2 at least. You have to have a frequency range that goes from 0 up to 999.9 for the frequencies that we use for FSM. So you've got to have at least 3-digit specificity. We have 4 that we get to use when we're using the MEN devices. And then this allows you to also create an interferential pattern. And then they have wires that plug in, and you conduct with sticky pads, conductive material, silver mesh gloves. None of us use graphite gloves anymore because they fall away. There's probes. I'm going to show you all of this. And then this is how it gets delivered to the patient. So remember, there are devices that are single channel microcurrent. They work differently, sinusoidal waveform, but they're really, really still powerful to have because their effects are different. So this is what that MEN professional looks like. I have it up on the screen, and you can see that it has a display with a backlight, so it's really easy to see what's happening. And then there's a keypad that allows you to modulate anything you want in that, because it's not only for pressing in frequencies, but it also acts as functions also. And I'm going to just go through this very, very quickly. I'm far more interested in you learning the material behind it. MEN technology actually has a YouTube channel where you could look at this, and then you could see all of the operations. Simply turn it on, and then you can start it. You can stop a protocol or turn it off. You can pause a protocol for 30 minutes, and then you have function keys where you can go into a main screen by going to the left. You can change where you are on your screen with the right. You can scroll up and down through your protocols when you have the device. And then this allows you to also scroll through the different functions for all protocols, recent protocols, the history of the protocols that you've run. And then you can do something called batch, which is amazing, which is where you can daisy chain 9 separate protocols together, and they run back to back to back when you start it. So this is where people can run a protocol 8 hours all night if they wanted to. Lots of flexibility. So on the screen, this is protocol number 6 that's on this device. It's spinal cord, polarized positive. We talked about that. The L stands for long. It's a long program, and you can see we're on protocol 10 out of 15, which is what this middle line is right here. There's still 1 hour and 16 minutes. It's a really, really long fibromyalgia full body pain protocol. But look at the frequencies, because we already talked about that. F1, frequency 1 is 40. Remember, inflammation. F2 is equal to 10 hertz, okay? So you've got 40 hertz and 10 hertz, and that's inflammation in the spinal cord. So there are some devices where people have everything encrypted, so you can't see this. Practitioners really, really need to see the frequencies that are running so they understand what's happening in their clinical practice. So you can see all of the different functions that you have on this device. Starting at the bottom, you can take any frequency pair. Okay, so 40 and 10 is running. There's 3 minutes and 55 seconds left. I could actually decrease this time by pressing the T minus. And then I can then increase the running time by pressing 3 right here. So decrease and increase. And then I can change the waveform. Here's the waveform right here. It'll either have numbers if you do one custom, or it'll say gentle, moderate, sharp. There's also tsunami waves. There's also triangle waves. There's sawtooth. This particular device has the most flexibility with the waveforms. And then you can skip a frequency if you want by pressing 8, and then 9 and 6 increase the current. So remember I said that we typically default to 100 microamps when we're running current. But if I was dealing with like a horse, I could increase this 100 microamps right here to 400. And then if for any reason I needed to change the polarity, remember we talked about positive polarity or alternating, I would press the number 4 function button, and this would create where this plus sign is to go to alternating or negative. Now we don't run negative, so we skip that, but you would be able to change it to alternating if you wanted. And then on the bottom, it tells you how much time is left with the frequency pair you're running, which right now is 40 and 10. The pairs that you are on for the protocol that you're running, this is 10 out of 15, and then the total time left on the device. So it's really, really helpful to know what we're doing. So that's the generals of the functions of this particular device. It is the most versatile on the market right now, in my opinion, as far as what we can do with having it be so easy to carry with us anywhere. You can slip it in a pocket, a purse, a fanny pack, very, very easy to travel with. And by the way, it's fine to travel. So on the lead placements, you're going to have leads, the red and yellow leads plug into the positive ports, and the blue and green plug into the negative ports on the device. Typically, the positive ports that you have are going to be on the spine or the back of the body, and the negative ports or negative leads are going to be on the front or distal to the area. So when we're polarizing something, the body is more positive in the center and negative on the outside. So this is where it's also made very, very easy. I'm just going to step over here. And Sam, I'm just going to show this on the camera, if that's okay. So tell me if you can see this. Oh, Sam, I think I'm going to need you to put the camera on for me. Thank you. Sorry. Okay, that good on the top? Okay, so here you can see the ports on the back. We use the middle output ports, and the ones on the far left, which you'll see, we use when we're using probes. So here's probes right here that we can also plug in. So here are your output ports. Notice they're color coded for you, so it's very, very easy to see. There's a smaller device that's called a home care, or which is right here, and this was the old Precision device. Okay, these do not have the same level of flexibility, but this is also a 2-channel microcurrent unit from Precision, and this is a wellness unit which holds up to 99 protocols. And then this unit, see if I can get the camera here. We go. This one does not let patients modulate everything like you can on a professional device, but practitioners, me especially, use these devices all the time. So you can increase and decrease the microamperage. There's still a backlight. Same thing with starting it. There's a backlight so you can see. You can get into your main menu. You can start all your protocols, and then you can scroll through your protocols. So super, super easy to use. Thank you, Sam. So we can also use alligator clips with this, and the alligator clips have no polarity with them, so it doesn't matter how you plug them in. Thank you, Sam. But you're always going to use the middle ports when you're running just regular FSM treatments through the body. And then when you run ports, that's when the probes, that's when we use the lateral ports. I got stuck. Sam, I got stuck. And then I'll watch to see what you do right here. Oh, that was easy. Okay. So here's an example of all these different ways. It's just easier when we're not in a live classroom together where you just see all of this on the screen. So on the screen, you can see here are your sticky pads plugged in, okay? Then if you can also just have these married together where the blue and the green are together and you only need one sticky pad. So you can see that right here. These are the conductive strips. These are basically indestructible, last forever. You can spray water on them or you can wrap them in paper towels and they deliver the current beautifully. Sometimes it's just easier in clinical practice to use the sticky pads. So you could just put one sticky pad here and one here. People also will run microcurrent into the head for when people have temple pain, when people have TMJ, sometimes for headaches. And then you can just hold it in place with a headband or you can use sticky pads. Here's your alligator clips right here. And notice on that, we're just putting those alligator clips on a damp towel. So you have to have either sticky pads or the conductive material has to be wet or damp in order for it to conduct through the skin. This is one of those black conductive strips where we would roll that up in a towel. Practitioners will always say it's like making a fajita. And then the last is the probes right here. And on the probes, you only use one channel because it's one positive, one negative, creates a complete circuit. And Jimmy and I are going to show you how that works tomorrow. Here's the other beautiful thing. So I love working with children. I do pediatrics and I'm also a doula. So not only have I done a really great job on getting women pregnant that could not get pregnant. So we're talking people for years that had not been able to get pregnant, 2 treatments, and they're pregnant within 3 months. So see this happen over and over again. I've got 2 miracle babies for people that were told they would never be able to have children, and then they found themselves pregnant. Fortunately, they were in great relationships and it was just a blessing. Some people that had adopted children. And so it's really, really easy to get people pregnant because you're actually correcting the physiology from the cell down and also the central nervous system. So I always tell women now, if you don't want to be pregnant right now and we start doing microcurrent, you need to make sure that you're using birth control or abstinent in some way because you could find yourself pregnant, which is what happened with 3 people. They're like, oh my gosh, I'm pregnant. So just know that with microcurrent. But then once we get these women pregnant, now I get to help deliver the babies, which is pure joy, which means I get to treat the children as soon as they arrive on the planet. Yes, you can treat babies when they're born. I usually have the mom hold them. The mom becomes the electrode to put the current into the child. Although I have treated children directly for different things. And then there's some manual therapy that we do. But you can see that you can drop the wires, okay, the leads into the bathtub. We put the device in 2 Ziploc baggies or any kind of sealable plastic baggies so that you can see the display, and then you can run the device, usually put a towel over it to protect it. But we use this while we're in hot tubs where the whole family, a whole group of people can get treated at once. This is where we do a lot of the like grounding type protocols, nervous system reset, anti-aging. But then also for my kids, especially I work with a lot of kids that have severe scoliosis. Some of them will need to have surgery. And one of the ways I actually loosen up the spine and the dura and get that spine flexible before surgery is that after we've treated them, I put a microcurrent device on them. We put it in a fanny sack. We have the sticky pads on them, and then I send them rock climbing so I can have the maximum stretch in the spine. So we've had great outcomes with that as well. So just know there's no end to what you can do. But most importantly, when you run microcurrent, all of you need to be hydrated to work. It's what makes it the most effective. And you will find out when you start doing microcurrent in your clinical practice, you will find yourself more dehydrated. So make sure that you're drinking plenty of water. Make sure your patients are hydrated. And now we're going to take a, let's take a 10-minute break, and I'll see you back at 20 till. And all of you can go get some fabulous hot tea or some water. I encourage you to get up and move around. And I look forward to seeing you back. And then we will talk about contraindications one more time. Thank you for your attention.